Coco and Teal.
Welcome to another episode of Coco and Teal Speech Therapy. I'm Teal, this is Coco. Oral motor exercises are tasks that are designed to test or expand on the range of motion or muscular control of the oral mechanism, aka the mouth. Some common examples of oral motor exercises might be lip protrusion, lip retraction, or tongue lateralization. Use of oral motor exercises in the field of speech-language pathology has been controversial in the past and continues to be controversial because some research exists that shows that use of these oral motor exercises does not result in a measurable improvement of speech sound production. However, within the field of speech therapy, there are therapists who practice what's called orofacial myofunctional speech therapy. And these therapists use oral motor exercises, transitioning through different oral postures and movements to treat disorders ranging from swallowing, chewing, and skeletal and dental development. Clearly, there does seem to be a disconnect between research and clinical practice when it comes to this topic. I definitely selectively choose which clients to use oral motor exercises with. The three main populations that I find oral motor exercises to be helpful for in the early intervention population are kids with feeding problems, kids with apraxia, and really quiet babies who we are trying to encourage to babble and explore sounds. Let's talk about feeding kids first. Kids who are at risk for aspiration or who have low muscle tone or weak oral musculature are often at risk of aspirating due to food material that's been left kind of pocketed in between the cheek and the gums. And for these kids, we want to be able to cue them to use their tongue to clear that out. This might be running the tongue along the teeth or inside the cheek to get that little bit of food out so that it doesn't go down their throat when they're not prepared and ready to swallow. When I start working with kids with apraxia, we often need to break words down into the smallest units of sound and practice one syllable at a time. It's important for kids with apraxia to practice oral movement, not just a single sound like ah, ah, ah. We actually need them to practice some kind of movement as they're producing the sound. So a better target might be la, la, la. You see how there's a movement involved there. So for kids with apraxia who are unable to make some of these movements within sounds on purpose, I often encourage their parents to use a reverse camera, use Snapchat on a reverse camera, or practice some different movements of the mouth in front of a mirror, simply to acquaint their child with what these movements feel like, and also to provide a visual cue of what the parent's face looks like when they're producing a sound like E, and use that visual for the child to be able to match both the visual and the sound that's coming out. Another place where I encourage use of oral motor exercises or demonstration of different and interesting oral postures are with these babies who are not big babblers, and usually babies who aren't big babblers turn into toddlers who are not big talkers. So we love to nip this in the bud. When we find a baby who's not babbling, we want to encourage them to start exploring their mouth. And a great way to do this is providing some visual examples that are interesting and funny and fun for the child to maybe try to make on their own. So again, I advocate parents to use Snapchat or simply your reverse camera, or practice some different postures, even demonstrating a simple babble like ma 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 in front of a mirror, again, so that we can provide this visual alongside the auditory. So even though we're not practicing meaningful words, even though we might just be practicing silly faces like, this is really important in encouraging kids to try different things with their mouth. And this is the whole point of babbling, exploration. So that pretty much sums up my stance on oral motor exercises. I definitely don't use them to perfect speech sounds. I really think about oral motor exercises as a tool to increase awareness of this mouth that we're all born with. Especially babies and toddlers need an opportunity to practice really simple mouth movements, sometimes even to make them aware that they have a mouth that they can use to make all kinds of interesting sounds. I hope you found this video useful, and I hope it gave you something to think about. Please comment below if you agree or disagree with me. Let me know how you use oral motor tasks with your early intervention population. Thank you for watching this week's episode of Coco and Teal Speech Therapy. See you next week.